Now to the State House tonight. That's where lawmakers are working to address a health care shortage. A committee meeting today to talk about a bill that could pave the way for nurse practitioners to go into rural areas to operate independently. Our Josie Frost joining us outside the State House with the details. Josie?
South Carolina needs more physicians. We're expected to be short by 3,000 doctors by next year, according to the Department of Health and Human Services. Now, lawmakers are considering ways to fill those gaps.
For me, it's about making sure that we get qualified medical practitioners in the rural areas. It is really not fair to ask somebody to get in the car and drive an hour to go see a doctor. And that's happening in South Carolina now, whether we like that or not.
A packed House filled a Senate subcommittee meeting on Wednesday. A bill would allow nurse practitioners to practice independently after they reach 4,000 hours of supervised practice with a physician. It would mean nurse practitioners would not need a physician's signature to provide care, something that 37 other states have already done.
We want to increase access to health care and allow medical professionals to practice to their full scope of competency. But at the same time, we want to make sure we maximize medical health care outcomes.
According to the South Carolina Nurses Association, the 13 states that do not grant this authority to nurse practitioners rank among the bottom 20 in the nation for health outcomes.
Senate Bill 45 does not allow APRNs to be physicians. Period. It does not miraculously turn APRNs into cardiologists or orthopedists or plastic surgeons or neurologists or any of the other categories of physicians whose services and expertise are so incredibly important to the patients they serve.
But some say nurse practitioners should still be required to operate under a supervisory agreement, even if every task doesn't have to be supervised.
I think it could be risky. Many of the tasks that nurse practitioners perform can be done independently, but still maintain that connection, that supervision that I just mentioned to you. Nurse practitioners are not physicians.
The legislation still needs to be approved by the full Medical Affairs Committee before it's taken up by the Senate when lawmakers return to the State House in January. Reporting at the State House, Josie Frost, News 19, WLTX.
Well, that committee hearing testimony on the bill today but did not take any action. Lawmakers also discussed bills allowing more international teachers to fill vacancies and expanding the roles of physicians' assistants.